Palpation of precordial area. During palpation of precordial area, we can determine apex and heartbeat, and so we can determine such symptoms as cat murmurs if patient has mitral or aortal stenosis, and some other palpation. And further we touch to these symptoms. For palpation of apex beat, it's necessary cover of precordial area with 4 fingers and try obtain information about pulsation. What, for example, I feel here pulsation. For proper localization of apex beat and other its qualities and quantities, it's necessary flex fingers and try determine vertical line where will be situated apex beat. For more accurate determination, we turn fingers in horizontal position and palpate over intercostal space and obtain information where situated apex beat. Apex beat usually situated in normosthenic person 1–1.5 cm medially from midclavicular line. But if patient has hypertrophy, and especially in combination with dilatation of the left ventricle, apex beat can be situated in the 6th or even in the 7th intercostal space and sometimes can touch up to axillaris anterior line. Heartbeat. Heartbeat usually we palpate along left side of sternum, and this pulsation usually connected or arise if patient has hypertrophy and dilatation of the right ventricle. And at the same time, we can palpate heartbeat in epigastric area. But at the same place, we can obtain pulsation not only due to presence of heartbeat, but due to pulsation of abdominal part of aorta, especially if aorta has aneurysm. For differentiation, we try palpate this beat during deepest inspiration and expiration. If patient do deepest inspiration, and we can palpate this beat, in the biggest amount of cases, this pulsation connected with heartbeat. But slightly below and during deepest expiration, pulsation connected with aneurysm of abdominal part of aorta. Cat purr, diastolic cat purr due to mitral stenosis. Covered suspected area of this vibration and determine so-called diastolic cat purr connected with mitral stenosis. From the right side of sternum, especially over second intercostal space, along right side of sternum, we can palpate so-called systolic cat purr, connected with stenosis of aorta mouth. In the fossa incisurae, we can palpate sometimes vibration or pulsation if patient has aneurysm of arcus of aorta. And along left side of sternum, over second intercostal space, we can palpate sometimes pulsation due to problem with truncus pulmonalis. That's all. Practical skill is finished.